Good afternoon, everyone. My name is Lauren Kelly-Wayman, and I'm here today in my capacity as the Executive Director of Community Health and Pharmacy Services with the Department of Health and Wellness. I'm delighted to be here today to welcome you all to this announcement at the Mount in Charlottetown, Prince Edward Island. This building houses many health P.E.I. services, including sexual health options and reproductive services, SHORES, clinic who provides safe, confidential, supportive services for all Islanders. Thank you to the Director of Community Specialty Services for welcoming us here today. I would like to welcome the Honourable Minister Mark Holland, Federal Minister of Health, Sean Casey, Member of Parliament for Charlottetown, Honourable Minister Mark McLane, Minister of Health and Wellness, Honourable Minister Jenn Redmond, Minister of Workforce, Advanced Learning and Population, and the Minister responsible for the status of women, Susie Dillon, MLA for District 11, Charlottetown Belvedere, and all those who took time to join us for this special announcement related to National Pharmacare and Drugs for Rare Diseases bilateral agreements. I will now pass the floor over to the MC for the day, Sean Casey, Member of Parliament for Charlottetown.
Thank you very much, and good afternoon, everyone. I'd like to begin by acknowledging that the lands in which we gather are the traditional territory of the Mi'kmaq, Abiguit. They are the past, present, and future caretakers of these lands. All of our distinguished guests have been introduced, save one. So to our ministers, to Susie. It's nice to be here with you. I'd also like to recognize my colleague Bobby Morrissey, all the way from Egmont en route to the airport. Nice to have you here, Bobby. And I would like to extend a big thanks to the Sexual Health Options and Reproductive Services Clinic for hosting us here today. The organization has contributed immensely to advancing sexual and reproductive health services in our community, ensuring Islanders have the access to care and the resources they need. Nous sommes heureux d'être avec vous pour cette annonce importante qui va améliorer l'accès aux médicaments dont les habitants de l'île ont besoin. Today's news builds on the success of the Improving Affordable Access to Prescription Drugs initiative, which has already saved Islanders over $8.6 million in out-of-pocket prescription drug costs and expanded formulary access to over 100 medications. Cette nouvelle étape de notre collaboration avec l'île de Prince-Édouard permettra de réduire encore les obstacles financiers à accès aux médicaments dont les gens ont besoin. Please note that there will be an opportunity for media to ask questions following this announcement. And it is now my pleasure to introduce the Honourable Mark Holland, Minister of Health. Minister Holland was first elected as Member of Parliament for Ajax in 2004 and then re-elected in 2006, 2008, 2015, 2019, 2021. But key turning point in his career happened in 2016 when the whip of the day assigned him to the seat exactly beside me, otherwise known in Parliament as the lucky seat. It is the seat through which cabinet ministers, consuls general, and senators pass on their way to an upward trajectory in their career. And as has become the pattern, Minister Holland went from the lucky seat to become the whip for the government, and then on to House Leader, the government House Leader, and now finds himself in the very, very busy and important role of Minister of Health for Canada. In both public and private roles, Minister Holland has backed health-related initiatives. He served as the Executive Director of the Heart and Stroke Foundation of Canada's Ontario mission, as well as its National Director of Children and Youth. And I couldn't be more pleased to see my former seatmate, Canada's Minister of Health and the member for Ajax here in the riding. Welcome to P.E.I, Minister. After getting in here at 4 o'clock in the morning, I'm sure you're going to do just fine. Welcome, and the floor is yours.
Thank you so much, Sean. Well, you know, there's something to be said. If all of your seatmates are this successful, there's obviously a lot of wise counsel and advice that you're sharing with the people you're sitting next to. So I thank you for that. You've been a tremendous friend and such an extraordinary colleague over these very many long years. Bobby, wonderful to see you as well. And I think for Sean and Bobby, this is a very exciting day for us. Aujourd'hui, c'est un jour tellement important, vraiment absolument pour l'île ici, mais pour le Canada aussi. C'est le troisième entente avec une province partout au pays. Et c'est pas juste une question de abordabilité, c'est vraiment une question de productivité aussi, la croissance économique. And this is an opportunity to build on the work that we've done together. You know, I really want to say to Mark, Minister McLane, you've been such an exceptional partner. You know, when one of the first places I came, Sean, you will recall, we had a conversation. I just became health minister. Sean said, you got to come to P.E.I. We're doing some really important things here on pharmacare that are really foundational to what we need to do across the country. And so I got on a plane right away, had an opportunity. Mark, we did an event where we talked about the extraordinary things that that pilot is doing, saving islanders hundreds of dollars, reducing their copay to $5, totally transformational, not just in terms of affordability, but also in terms of their health. Because we know when people get the medicine they need, they don't get sick, right? And that's the health system that we need. We need to move from an illness-based system to a wellness-based system. So today we take another really essential step in that journey. Aujourd'hui, le corps sur l'assurance médicalement est la prochaine étape de la transformation de soins de santé au Canada. And this is a more than $30 million deal over the next 4 years to provide universal access to contraceptives and diabetes medications, devices, and supplies for residents of P.E.I. This will ensure that nearly 16,000 islanders for diabetes can access their essential medicines. It will provide reproductive freedom for more than 41,000 islanders. Coverage for these products is going to begin the 1st of May. And before I turn it over to my friend, Minister McLane, let's just talk about what that means. And, you know, Jen, you and I were talking a little bit about that earlier, about the personal stories, the people in our lives, and I'll leave it to you to share that. But just what the journey is like for somebody who gets a diagnosis of diabetes. And just imagine how difficult that is on its face. Your life is transformed, the life of your family is transformed. And then you got to mix into that for so many families. Can we afford the medication? How are we going to pay rent? How are we going to pay for groceries? And all too often with that story, people say, well, you know, I'm not going to monitor my diabetes today. So I'm going to throttle my use of devices or strips. I'm going to make a decision not to take my medication so that I can afford other things. And then what's so sad and frustrating talking to doctors is those same people then will come in with much more serious conditions. Often, it sometimes can lead to limb loss or blindness, or God forbid, another chronic disease, or even worse, death. This is not the country we want to be in, and it makes no sense. Because as I said at the top, this isn't just about social justice. It's not just about ensuring that every patient has access to the medication they need, but it's about them being productive and healthy and happy. You know, I talk a lot about my mom. My mom's 80 years old. She's tailgating at Bills games. She's still a practicing psychotherapist. She's having the time of her life. She just said it was the best year of her life. We want that for everybody, right? And it's possible for everybody. I know for Sean and Bobby and I, driving this transformation in healthcare is everything, because it means not only that more socially just, exciting last 10 years of life, where we expand on the benefit that we already have. Canada's already one of the world leaders in the number of years that we live in wellness and not in illness. But it's going to make us more productive and cost us a lot less money. And I'll end here talking about the extremely important news of universal contraceptives coming here to BC. You know, for a woman making a decision about whether or not she does or doesn't want a family and having control over her own body is essential freedom. And making sure that she can afford the medication to make those choices on her terms, it just makes sense. And today, here in Prince Edward Island, by announcing this, we're setting that future into motion. So, Mark, we made deals on aging with dignity, on working together, we're looking at primary care. We're also announcing today drugs for rare diseases. This is another really important step forward in making sure that the folks in about 1 in 12 people are diagnosed with a rare disease. That we're making really important progress with $10 million over 3 years to help expand access to drugs as well for people with rare illnesses. So in conclusion, I just really want to say a huge thank you. The Prince Edward Island is already such a leader in working with folks with diabetes and finding solutions. This builds upon that work and shows what's possible when we work together as jurisdictions to improve our health system. With that, it's my pleasure to call on Minister McLane to deliver remarks.
Thank you, Minister. So it's a pleasure to join everybody here today. I want to thank the Director of Community Specialty Services at the Mount for hosting us here as well for this exciting announcement. So welcome to my friend Minister Holland, MP Sean Casey, MP Bobby Morrison, Minister Redmond, and also the MLA for this area, Susie Dillon. It's unfortunate. I thought Minister McCauley was going to be able to join us today, and I was kind of looking forward to recognizing him and his contribution to P.E.I., so I will still do that. Thank you for 36 years of service, Minister McCauley. Islanders appreciate everything that you've done in your time in government. So I also want to thank Minister Holland and the federal government for collaborating with P.E.I. and the National Pharmacare and Drugs for Rare Disease agreements. This $40 million investment will continue the work we are doing as a province to improve access to medications and make life more affordable. P.E.I. already has a well-established provincial diabetes program. That's part of the reason we are here today, because our program is strong and we are ready to move forward with new investments and expanded supports. In the past 2 years alone, we've made significant investments to strengthen our provincial diabetes program. We've expanded eligibility for the insulin pump program. We've invested about $800,000 in preventative foot care clinics, and we continue to increase our overall investment in diabetes care. We've also removed the age restriction from 25 years of age for the insulin pump program, ensuring all eligible Islanders can access funding for insulin pumps and supplies with up to 100% coverage. It was very remarkable to me is we had Jacob McEwen, who was actually a constituent of mine, who was 22 years old, and when we made that announcement, to hear him be interviewed about how important it was going to be to him and his family as he approached 25 years of age, that he was really concerned about the cost that he may incur or his family may incur to maintain his insulin program. So to Jacob and our insulin pump users out there, today is another step for supporting those diabetic patients on P.E.I. So these efforts aim to make diabetes management more accessible and improve health outcomes for the over 16,000 Islanders that are living with diabetes. This announcement today also reflects reproductive freedom for 41,000 Islanders by expanding coverage to 14 contraceptives. It provides Islanders with options for the type of contraceptive that works for them. So I want to thank the team here at the Shores Clinic for the work that they do every day, providing a safe, confidential, supportive service for all Islanders. This building is also the location of our midwifery program that we recently stood up, and I was very pleased to have a chat with the folks today that we now have 5 midwives operating this program out of this building. We've posted 2 new positions for Summerside. So if I go back 2 years ago, I thought it was going to be very challenging for us to attract 5 midwives to P.E.I., but here we are today looking at expansion to Summerside, so I'm very proud of that. So we've talked a lot lately in the coming past few days about cost of living, and I think this is an important part of helping Islanders who have challenged, who have to make difficult choices. So anything we can do to alleviate these barriers, I think, is extremely important, especially in these last few weeks. So very happy to support them. And when it comes to drugs for rare diseases, this is not something that many Islanders have to deal with, but for those who do, it can be devastating diagnosis. Some of these treatments can vary from 6 to 7 figures annually. This agreement improves access to drug, early diagnosis, and screening. So collaboration between the provincial and federal government is key when it comes to enhancing health care services on P.E.I. And I want to thank my friend Minister Holland. was probably one of the first health ministers to not show up for a meeting last week due to the resignation of our premier. And Minister Holland was checking on me to make sure everything was okay. And obviously I couldn't talk about it. So I appreciate it. I apologize for that. But again, we have a close relationship. We text and chat quite a bit. And I think this has helped us get to this point. We know we had some urgency to this deal, and so I'm very happy to be here together. So when we work together, we can achieve great things, and today is a great day for Islanders. So thank you very much. And I'd like to bring up Minister Jenn Redmond.
Thank you, Minister McLane. Good afternoon, everyone. It is certainly a great privilege and excitement to be here. Today marks a monumental day in our journey forward to removing barriers and access to healthcare supports for all Islanders. As the Minister responsible for the status of women, I am incredibly proud to be here today to see this work come to fruition. With International Women's Day approaching tomorrow, it is a timely moment to share this news. Everyone deserves the right to make informed decisions around their health and their bodies. We are on the right path forward by making more common contraceptives more freely available across P.E.I. And by working together with the federal government to remove these financial barriers, women and those who use long-acting reversible contraceptives, such as IUDs and some hormonal options, will be able to make more choices with confidence. It is important to recognize that having access to contraceptives is a fundamental aspect of women and individuals' health and autonomy. This will enable people to plan their families, pursue their educational and career opportunities, and make meaningful contributions to society on their own terms. And it also provides the assurance that every person can make the best choices for their health, their family, and their life. We are committed to continuing to advocate for reproductive health and increasing supports and access. And just before I step down, I didn't mention a lot about diabetes in here, but announcements like this are very near and dear to my heart. As most know, I do have a type 1 diabetic in our home and have been working through the needs and the supports and the tools and the insulins and all of the things that go with a diagnosis of that nature for the past 4 years. And these investments are key and essential to helping Islanders. It also draws a great deal of awareness. And for us in our home, awareness is around acceptance. And to have a daughter with 13, a big part of being a part of the diabetic world is accepting it and treating your health and being your best you can be. So I appreciate that immensely. Thank you to all the advocates, healthcare professionals, and community leaders that are here today for making this a possibility for all Islanders. Thank you very much.
Thank you, Minister Redmond, Minister McLean, and Minister Holland. And Minister McLean said it very well, but this is yet another example of the incredible collaboration between the provincial government in Prince Edward Island and the federal government. And so kudos to all that were able to get this project, get this agreement to this level in this time period. It is a recognition of the urgency and the importance of it. Collaboration is so important, as between levels of government, community organizations, and healthcare providers, in the best interests of access here in Prince Edward Island. So with that, I'm now going to pass it over to Matthew Cronenberg from Minister Holland's office, who's going to manage the question and answer.
Welcome, everyone. Bienvenue à toutes et à tous. We will begin with questions in the room before proceeding to questions on Zoom. You will be allowed one question and one follow-up. Please state your name, media outlet, and to whom your question is directed. Nous commencerons par les questions dans la salle avant de prendre les questions sur le Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question.
Hi, thank you very much. Stu Neatby from The Guardian. Perhaps this is a question for Mr. McLean. So P.E.I. already does have some coverage for a diabetes medication and contraception. So I guess I'm just wondering what exactly will change with this new agreement? Like what is covered more and how much more?
Well, yeah, the details, again, Jen would probably be better to explain the actual products and supplies, but again, testing strips will now be included and similar products like that. So again, it leverages on our existing program, and I think that was one of the reasons we were able to get this deal done with the federal government. I thought we might have been first. We ended up being third, but we certainly, because of the current provincial diabetes program that we have, we were able to do this deal fairly quickly, and we're very happy to stand here today.
I guess so. The improving access to affordable medication agreement, that's still in effect. There's about $11 million worth of funding for that agreement. So is any of that funding rolled into either of these two agreements, or is that completely separate?
It's completely separate. So there's, one of the things that's really important about what's being announced today is expands coverage. And so both for devices, for strips, for some of the things that are so critical for diabetes and drugs. And it offers it on a no copay basis. So this is huge because often that copay can be a real inhibitor to people being able to afford their medication. So what we're announcing today on contraceptives and diabetes is we'll have no copay. The pilot that we've been running, and I thank you for raising this because actually I should have mentioned it in my remarks, but I realized I was getting a little long. But this is really critical because we have now a pilot that we launched that is got copays down to about to $5 for Islanders, and that's saving folks hundreds of dollars a year on their medication. It's had a huge impact on adherence to their medication and improving people's health and on affordability. That's a separate program, and that is being delivered on more of a mixed model. It's a different model of delivering pharmacare. This is on a single-payer first dollar universal basis. So what's great is both of these things existing in the same jurisdiction allows us to really build a valuation around it and see the real-world impact of both models working. Because one of the things that has happened in pharmacare, and one of the reasons we've made no progress for decades, is there's been this battle about which is the right model to go forward on, which is the best one. Now we're actually going to be able to look at this in data and look at it at how it lives in the world. So these things are complementary to each other, but they operate differently, and that is great because we're going to be able to build a valuation around it.
Kerry Campbell, CBC. I think just further to what you were saying there, Minister Holland, when this legislation was passed, I think it was about a year ago, you talked about this providing the first step toward a broader pharmacare program, that this was a pilot project or a proof of concept. When we are days away from a new Liberal leader being named, and then from that going into an election, and at some point a new government of some stripe, what happens to this idea that this is a new pilot program from that point on?
So I'll say this is now two different programs that are operating in P.E.I., both of which are essential. So one of them, as I mentioned, is sort of on a mixed model. It brings copays down. The other is what we're talking about with diabetes and contraceptives. And, you talk about that legislation. Normally it takes 18 months from the point of introducing legislation to get to royal assent. So we're at 1 year and a couple of days. So, for Sean, for Bobby, for Lawrence, and for all of us, like, getting this done at speed is critically important. Now, this deal comes live May 1st. So that's going to start having effects for Islanders right away. In terms of, the background of what's happening politically, look, I think, this is my 8th time running, on an election. Sean was listing off those numbers. He's done a few himself. What is that you just got to keep focused on the job and getting things done. And there is a committee that's looking at the broader question of pharmacare. But the reason we haven't made any progress over decades is because it's so large that nobody kind of knows where to start. And, well, it's towards the end of the term, so you start, maybe you do it next term. So it never happens, right? Decades go by. This stuff is real. This is medicine in people's hands. And the chief criticism the Conservatives have had against pharmacare is that it doesn't exist, right? They said the same thing about dental care. Dental care, well, it doesn't exist. It's not real. 1.5 million Canadians have accessed the Canadian Dental Care Plan. 94%, actually I think it's now 95% of oral health providers are participating. The Conservatives said no, nobody participate. So, we made that real. And now, again, here on Pharmacare today, this is real. This is medicine in people's hands. This is lives transformed. So they can't get away with saying it's not real. And I would say, they got to come clean with folks. If they don't believe people should have diabetes medication or contraceptives, then be straight with people about it. But you can't hide in shadows on it. And I think that we as a country need to have a conversation. Look, we're having a conversation, a really important conversation about what it means to be Canadian right now. Coming together, having each other's backs. And I would say one of the really chief points of distinction is our healthcare system. That when you walk into a hospital, they don't say, what's the size of your bank account? They say, what's the size of your need? That's a key point of distinction. And I think Pharmacare builds on that distinction. We live in health 6 years longer than the United States. We live 4 years longer, but it's even more important that we live in good health 6 years longer. We need to keep expanding that advantage. That's an incredible Canadian advantage. It needs to be looked at alongside of things like GDP.
All right, and I'll have a question for Minister McLean. When you talk about how this new diabetes funding will fit in with P.E.I.'s existing program, I guess a couple parts to this question. Will this make access universal now, that every islander with diabetes will qualify equally? And what happens with the co-pays in the provincial program? Because Diabetes Canada has been asking the province to get rid of those. I think it's $10 a vial. It's a significant co-pay right now.
Yeah, the details, again, we will launch earlier than most jurisdictions. I think we'll be live on May 1st, which, again, back to our size, enables us to move forward a little faster than most places in order to iron out those details. So from a co-pay perspective, my understanding is that it will still be $5 that will apply to these medications. So,
No.
Oh, sorry. No,
For
sorry.
these medications,
Not
there's
these
no
ones.
copay.
Yeah, no
copay.
ones, sorry. And as talking with Minister Redmond too about her family, there's, I think the important part is the throttling, and is that some of our diabetes patients on P.E.I. are managing some of their medications due to cost. So that will, have significant impacts on health outcomes. So again, being able to invest this much into our diabetes program, I think will have a lot of upstream effect on P.E.I.
We will now take questions from journalists on Zoom. Nous passons maintenant aux questions sur le Zoom.
Let's see. Thank you very much, Matt. So as Matt said, we'll take questions now from our Zoom journalists. If you're a reporter and wish to ask a question, please use the raise your hand function. Please limit yourself to one question and one follow-up. And unless I've stated it, please indicate your name and media outlet before asking your question. Nous allons maintenant prendre des questions de Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Et s'il vous plaît, limitez à une question et un suivi. Et sauf que j'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. The first question is Tessie Sanchi from the Hill Times. Please go ahead, Tessie.
Hi, thank you for taking my question. I'll direct my first question to Minister Holland. About the Improving Affordable Access to Prescriptions pilot program. When that was launched, it was supposed to be for a limited period of time, 4 years, which would take us to 2025. How much longer is this pilot program going to last? And speaking of data, when exactly do you expect to have this information that's going to tell you how well, this mixed payer system has been working?
Yeah, thanks so much for the question. So let me answer the second part of it first. Which is there's an expert group that is convening pretty much every day in Ottawa looking at the future of pharmacare. And so it's really digging into these numbers and taking a look at the question of the future of pharmacare in Canada. And so the evaluation around how this is working in P.E.I. is an ongoing bit of business that's going to continue and needs to. In my view, we need to continue this pilot. This pilot is having huge result for islanders, and I think there's such an advantage of being able to evaluate that pilot, which is on a mixed payer model, which is with the single payer universal model, and see what the impact is and be able to look at it in the same jurisdiction. So, there will be a decision to be made in terms of the continuation of the program. I can say that Jenn and Mark have been very clear that they want to see this program continue, and I agree with them. It's had tremendous results.
Thank you for that. So just to clarify what you said about the expert committee, the pharmacare expert committee, does that mean they are already receiving data from, this P.E.I. pilot project? And if I could just add a separate question, because that was more clarification. My second question will actually be to Minister McLane. You mentioned that you're a smaller population, which will help you be able to launch the pharmacare program earlier than other jurisdictions. Any other reasons as to why you guys think why you guys are the first ones?
I'm not so sure we're the first, but again, I know our date is a little bit more quicker than most other jurisdictions. Again, we have prorogued our legislature here in order to redo our budget with the current fiscal environment. So from a budgetary planning perspective, the timing works out very well for us to incorporate this into our planning for the next fiscal. So I think that's important. And back to IAPD, back to the data, we are certainly sharing data back to Ottawa, and just preliminary figures is about a $9 million savings to Islanders. So we're very proud of that. And I think, again, back to my comments about upstream and people getting the medication when they need it is very important. And I think we'll have some long-term impacts on our healthcare system here in Prince Edward Island.
And I'll just add on the first point, this is why this thing just makes sense, right? Because it's, as Mark just said, you're talking about affordability and the money that it's saving Islanders. And then you're thinking, we also are evaluating the impact on health outcomes, right? Because this is improving people's health. It's stopping them from getting sick. So we can build a valuation around that. And then, of course, it has a huge impact on productivity. People who aren't sick and healthy are able to work. So it is a situation, and I'll just take contraceptives in BC. BC was first out of the gate on contraceptives. And already the early evaluation coming out of BC is indicating that they might be saving more money than it costs them to provide the contraceptives. And that's because when you properly manage your health and with the right drugs and the right care, you don't get sick. And not being sick has a huge impact on reduction of costs and illness, and has a huge impact positively on productivity. So I just say I don't know how anybody can be against doing this kind of stuff. It just makes sense. The key is that evaluation. And so we have to evaluate on all the metrics. How much is it saving folks? How much is it improving people's health? And what kind of impact does it have on productivity?
Perfect. Thank you so much. Any other questions on Zoom? Dernier appel pour questions sur le Zoom. The event has now ended. Thanks for joining us. L'événement est maintenant terminé. Merci de vous joindre à nous. Thanks all, everybody.
All right, great, fantastic. That's fantastic.